All right, now we will open up questions to the audience. And I will repeat the questions so everyone can hear when you ask them. Yeah?
What type of health care do you receive as a representative?
What type of health care do you receive as a representative?
And why do we not deserve the same health care that you receive?
And why do we not deserve the same health care that you deserve to receive?
I have Blue Cross Blue Shield health care, which I pay for. It is basically the same plan that I had when I was teaching at Appalachian, when I was a state senator, and it's the same health care that millions of North Carolinians have. So anybody basically can have the same health care plan that I have.
Is your health care in any way subsidized by the federal government?
All health care that's in group plans is subsidized by an employer. Every health care plan offered by an employer, or almost everyone, is subsidized partly by the employer.
Okay. Can I make a comment on that question? I get my health care actually as a graduate student at Wake Forest University because I'm finishing my master's degree in bioethics. Right now, I'm obviously not in school. I am busy campaigning. One of the reasons I personally am not insurable outside of a group plan, and without the Affordable Care Act, I would be unable to purchase insurance on the open market. So,
All right, any other questions? Yes?
This is primarily directed to Ms. Fox. I was somewhat confused in the debate with Romney's presentation of his ideas about health care. On the one hand, he said he would keep certain parts of the Affordable Health Care Act, and on the other hand, it was a state. We sort of had to wait for the state to come up with a health care situation for us. Would you please clarify your party's stance on the role of the federal government in health care? Do you support keeping some aspects of the Affordable Health Care Act, or do you disagree with Romney?
I'm going to say it. Will you please clarify the stance on the Romney's side of health care? This is basically it. Okay.
Right now, health care, before Obamacare came into effect, was basically regulated by the states, is basically regulated by the states. And so insurance companies are approved state by state for what they do. It's my understanding that most insurance companies have gone ahead and offered the health care benefits and insurance to students who are still in school or young people up to 26 years of age. A lot of changes have occurred in the private market as a result of some of the pushes that came through Obamacare and other changes that have occurred in the market. But basically, again, we believe that health insurance should be regulated at the state level, not at the federal level.
let me add that what went into effect this year was the requirement that you could not exclude children because of pre-existing conditions, and including people up to age 26. And that's one of the parts of the Affordable Care Act that is very appealing to many people and actually would have a lot of pushback should it end. Part of the reason there was a need to come up with legislation is that the industry and the market by itself was leaving a lot of people out, and they were really frozen out with no other options. So I don't think that it went into place because we had a system that was working. One of the difficulties in the United States is we haven't actually had a healthcare system. We've had a hodgepodge of different things, some market-driven, some less market-driven, and we're all living with the consequences of that.
Okay, is there any more questions? Yes?
This is for Ms. Fox and Ms. Motsinger. Ms. Fox, did you vote for the Ryan budget that called for $716 billion worth of cuts to Medicare, Medicaid? And Ms. Motsinger, would you have voted for that budget?
Did you vote for the
Ryan budget.
Ryan budget.
okay, the Ryan budget and Ms. Motsinger would you have if you were in office?
I proudly voted for the Ryan budget, but the problem that you have is that you are making an assumption relative to baselines. It gets a little bit into the weeds when you talk about it, but because of the way Obamacare treated the $716 billion that was cut out of Medicare, the baseline was
Time.
recreated, and that's why you're asking, did we vote for that? Republicans didn't cut the $716 billion out of Medicare. We did not. What we had to do was vote on a new baseline that was created as a result of what Obamacare did.
Time.
Quite simply, no, I would not have voted for that budget.
All right. One more question, if there's any. Yes?
So a lot of aspects of the Affordable Care Act have not been put into place yet.
Exactly.
One of the big things that hasn't gone into place is the state insurance has changed, and the states are still prepared to do it. And it just struck me a little funny that Ms. Fox, you said that insurance premiums have gone up because Obamacare was passed. But one of the big features of the Health Care Act is to put more insurance companies in competition with each other, which would drive costs down. So I view it more like insurance companies getting one last lick in on the public before they have to compete with each other. So I just would like you to clarify that how the passage of the Affordable Health Care Act actually boosted insurance premiums. That's all.
How does the package of the
How does the passage of the Affordable Care Act, how did that lead to increase in insurance premiums?
how does the passage of the Affordable Care Act lead to increasing premium?
What we know is that since the Affordable Care Act has gone into effect, that insurance premiums have gone up on average, as I said, $2,400 a year for the average family. You're making an assumption that it is the insurance companies, quote, getting in another lick. You're not assuming that it's because of additional costs coming in. To cover people who are up to age 26, that has to be covered by somebody. Or do you think that would be done for free? Are all of these things being done for free? When you add mandates to the insurance companies, you add cost. And so it's simply because of the mandates that have been added that have already gone into effect. As Ms. Motsinger has said, that went into effect already. There are several other things that have gone into effect. No, it all hasn't gone into effect yet, but you can see where it's going given what has
Time.
gone into effect.
If I may counter at one point,
I don't believe
No.
this is a debate with
No.
the audience.
Yeah, so I would like to answer, and first, Insurance rates have actually not all gone up. My daughter got a rebate on her health insurance because one of the things that has changed is that 80% of the premiums actually have to go to providing medical care and not just, so her policy, for example, actually was required to give a rebate to policy owners because they had not spent that 80% on insurance costs. My experience dealing with insurance companies as a healthcare provider has not been that their primary interest has been the well-being of their patients. And I have spent plenty of time on the phone trying to get sorely needed tests done or medication approved. And I'm very careful. I'm as cheap as a healthcare provider as I am as a campaigner. And you can be pretty sure that if an inexpensive generic will meet the needs of my patients, that's what I prescribe. If a patient does not need imaging, I never prescribe it just to be careful. I'm, again, as cheap as a PA as I ever have as a campaigner. So,
Thank you. Now you both have 2-minute closing statements.
10 minutes?
2.
2 minutes. That's a little long. I'm Elisabeth Motsinger, and it's wonderful to be here in Alleghany County. This is actually the elementary school where my husband, who now collects Social Security, went to elementary school. So it is a very special place to be here with all of you. I am a healthcare provider. I've been a PA since 1989. I went back to school when my first husband died, and I was able to do that because of Social Security and because of the student loans that allowed me to build a new life for myself and my 2 young children. I also have been twice elected to the school board in Forsyth County, and I am very committed to the well-being of all children. I am a great proponent of public education. I believe that we have to find ways to help all of our kids get to college and through college. College is much more expensive now than it was even when I went. When I went to PA school at Wake Forest, it was a total of $16,000 for 2.5 years tuition. That seemed outrageous to me then, but I know that tuition for similar programs are now running about $25,000, $30,000 a year. So it would be much more expensive. I love North Carolina. I believe our Congress has to be a place that is honorable, honest, where people feel comfortable. I believe that I can represent the people of North Carolina. I am a citizen of North Carolina. We have land up here in Alleghany County, and I look forward to going to Washington and representing the needs of citizens just like yourself. Thank you.
Ms. Fox.
Thank you. I'm Virginia Fox. I've represented Alleghany County for the last 18 years, 10 years in the state Senate and 8 years in the United States Congress. It is a great honor for me to do that. I grew up in Avery County in a house with no electricity and no running water. My mother had a 6th grade education, my father a 9th grade education. And as I tell that to people, I say I'm neither complaining nor bragging. I'm advocating for the wonderful country that we have that allows a person with an impoverished background like mine to be able to be elected to the highest legislative body in our land. It's been a great honor to serve the people of the 5th District while I have served in Congress. I worked my way through college. I went to school full-time and worked part-time. Went to school part-time, went and worked full-time. Took me a long time to get my degree, but I got it, and it's helped me tremendously in everything that I've done. All my work has helped me. I've worked all my life. I've gotten legislation passed as a state senator. I've gotten legislation passed as a member of Congress that has been responsive to the people I serve. I asked somebody in Alleghany County when I was running for re-election to the state Senate, please tell me what people say about me behind my back. This was a very honest person, and I knew I could trust her to tell me. And she said, people say she listens, she responds. I feel very much at home in Alleghany County My whole life has been built on service to others, and having that comment made about me made me feel very positive about what I have been doing. I continue to do that. I continue to listen. I continue to respond. I take my title of representative very, very seriously,
Time.
and I thank everyone for tonight.